Let's get to some more serious news first, and there's been some serious ramping at the Flinders Medical Centre and other hospitals today. Earlier I spoke to Phil Palmer, his State Secretary of the Ambulance Employees Association, just before we came to air, and he told me that it's been a bad week for our ambos, and today was particularly nasty.
It's been a really bad few days for ambulance workload and ramping, but this morning we had some 15 ambulances all ramped at the same time at Flinders Medical Centre. There are also ambulances ramped at the Queen Elizabeth at the same time, some of them for hours on end. But at the Flinders Medical Centre, there were so many crews ramped and other crews on jobs that there were no crews left, no ambulances left to respond to emergency jobs. And while our members were there all on the ramp at Flinders, a cardiac arrest, a Priority 1 life threat case came in. They all heard it come in, but every one of them had a patient on board because they couldn't get into ED. And they became, obviously as AMBOs do, their job is to save lives, and they once again were frustrated by their inability. So what two of them did is they joined together to make a crew. One patient was left behind in the ambulance in the care of one paramedic. The other one they took into ED and were ramped inside. They formed a crew and had to drive an ambulance with no stretcher at all in it. Fortunately, they got to the patient in 4 minutes, and that's fortunate because it was just round the corner from the Flinders Medical Centre. It was very close. They got there in 4 minutes, but unfortunately they were unable to retrieve the patient to save the patient. He was seriously ill, or she was seriously ill. Don't know the gender. On top of that, had the patient been retrievable, they would have had to go to hospital very quickly for immediate, more significant intervention by doctors. They wouldn't have had to take them to hospital. They had no stretcher. They were stuck there at home with that patient. Even if they could save them, they probably wouldn't have been able to, given the circumstances.
Is this the first time this has happened?
Where they've formed a scratch crew like that.
Yes.
It's the first time I'm aware of it ever happening. I mean, our members do try and help out from time to time by coming in from home when workload's really high and forming a crew just to help out over a busy time. I think they shouldn't do that. I understand why they do, but their home life is important too. But this is the first time I've ever heard of our members having to form a crew on the ramp and heading off in an ambulance without a stretcher. So, none of us have ever heard of that before.
I know this is a hypothetical, but if that patient was retrievable, as you put it, and needed to go to hospital, are you saying that the ambulance crew would just have to stay there with them until one of these patients was able to enter the ED and the ambulance was able to attend? So they would have literally just been waiting for the system to kind of chew through some people?
That's the best case scenario. The worst case scenario would be the person was brought back by our members but needed much more definitive care that only a hospital can provide and wouldn't have been able to get it. And it would have been too late anyway. The patient was in a very dangerous situation, and had they been savable, the ambulance crew wouldn't have been able to save them, wouldn't have been able to get them to hospital in time to save them anyway, because it took hours to clear the hospital. The hospital's still ramping as we speak now. So, it was a high-risk situation. The AMBOs did the best they could, and they should be applauded for the flexibility and innovation they showed. But I bet they're feeling extreme frustration at the situation they found themselves in.
I mean, that's a pretty concerning story for anyone listening, Phil. Do the ambulance service have to keep some ambulances in reserve, even with chronic ramping?
The ambulance service would love to have some ambulances in reserve, but it's beyond their control. The workload comes in. They've got no control over ramping at the Flinders Medical Centre or any other of the hospital EDs. They're stuck there. And while those patients can't get into ED, they're stuck in the ambulance. And while they're stuck in the ambulance is not available for the community. So it is a horrific situation, and nobody's safe. Nobody in the Adelaide metropolitan area is safe because we can't guarantee them they'll get an ambulance on time when they really need it.
Phil, what's causing so much ramping at the moment? I mean, we hear stories of, a really bad flu season, or is it just a coincidence? I mean, what would you put it down to?
Well, I'm not a medico, the flu season traditionally is still peaking in September, despite the fact that people try to tell us it's not. I would suggest that it probably is still the flu season and all the other respiratory illnesses. Perhaps it's, high pollen days as well. I really don't know. It's really hard to pin down. You can have a very busy day one day and not such a busy day the next. But we do know all the hospitals are overcrowded anyway. And when a day like this and yesterday occurs, there's no capacity in the system to take the overflow. There's absolutely chock-a-block. So not only ambulances are 100% utilised, but the hospital is 100% full. That means they've got nowhere to go. The whole system hasn't got enough capacity, and that gives us hospital overcrowding, gives us ED overcrowding, and gives us ramping.
We always kind of feel comforted by the fact that if there is a serious health incident, with us or with our immediate family, we can pick up a phone and an ambulance will be there soon. Do you think that we will have another occurrence of this, Phil, where there's simply no ambulance available and it could result in somebody's death?
It's already happened many times. There have been deaths over the years. And yes, I'd like to give you comfort that if you need an ambulance in a hurry, you'll get one, but I can't give you that comfort. And even if you've got a serious painful condition, say you're an elderly person who's had a fall and fractured your hip, now some of those people are now waiting 10 hours for an ambulance. And when they do get picked up an ambulance, they get ramped at hospital. It's diabolical. Jules, the situation's diabolical. People are suffering, lives are at risk, and nobody can be guaranteed getting an ambulance on time. I wish I could tell you different, but that's the way it is.
Are you expecting a response from the government? I mean, this is a pretty extreme and concerning situation, Phil.
Treasury are really the department who sort of do the interactions with the unions, and we've been fighting with them all year about resourcing and about ramping, so much so that we're taking them to the industrial court to try and get some orders or some assistance from the Commission to make them do something, because there seems to be no inclination on the behalf of Treasury to free up money to do what's needed to do to make South Australians safe.
Phil Palmer, it's a concerning situation, obviously a very stressful day for your members. Thanks for your time.
Thank you for your time, Jules.
That's Phil Palmer there. And Health Minister Stephen Wade was unavailable today, but he sent us this statement. There has been a period of high demand through our hospital system. I would like to thank our hard-working staff for their efforts during this challenging time and the public for their patience. Let's talk now to Shadow Health Minister Chris Picton. Welcome, Chris.
Hi, Jules.
Do you think the public just need to be more patient?
Well, clearly this situation is getting out of control. Firstly, I think it's pretty unacceptable that the Minister wasn't able to make time to speak to your program, given the serious issues discussed. But sadly, we're seeing ramping escalating out of control. The situation is now the worst we've ever had it, according to the stats. The stats show it's double the rate it was as of the election. You just have to look at this week, the concerning situation we have at Flinders, where ambulances weren't available, but a couple of nights ago at Lowell McEwen, doctors there were keen to order an internal disaster because of the situation there at that hospital.
What do you mean an internal disaster?
A code yellow was talked about being called there by the doctors, which is their sort of high level of internal disaster because of the significant overcrowding, ramping that they had at that hospital at that time. Waits well in excess of 8 hours that patients had just to see a clinician there. So the situation is getting worse and worse. I'm just particularly concerned at the fact that the government's response to this is not to open more resources, put more doctors and nurses in, but they're actually starting to now do job cuts of doctors and nurses, was announced last week. And that's just going to make the situation worse when clearly the demand shows that we need every resource available and we shouldn't be putting money before patient care.
Chris, many people would say, some health experts, that it's the peak of the flu season still, and if we just be patient, then this will calm down over the coming months?
Well, clearly there's a winter demand that happens every single year. I mean, one of the things that we were concerned about is that after last winter, the government decided to close 40 beds, some at the medical beds at Flinders, but also some in the central area as well. And they decided to not reopen those this year because they said, well, we're seeing high peaks of demand all year round. But clearly the sort of winter and early spring is a high demand period. We haven't seen those beds open. It's putting pressure on the emergency departments and ultimately through to the ambulances. And because if those ambulances are ramped, there's not going to be an ambulance when you need that one when you're calling 000. And as Phil was saying, people are waiting many, many hours, sometimes up to 10 hours to get an ambulance to respond to some pretty urgent cases. And that means that their situation is going to get much worse.
Chris, what would you like to see happen in the short term? Because, many people are texting through, what's the point of ambulance cover? What's the point of hospital cover? Other people are worried that they're ramping accountants instead of doctors in the health system at the moment. What would you like to see done in the short term just to ensure that some ambulances will be available for the most serious cases?
Well, clearly the government could decide to put more ambulances on if they wanted to. It's a question of resourcing. And I think that they immediately need to cancel this crazy idea of removing doctors and nurses from our hospitals, because cutting those positions in our hospital is only going to make the situation much worse. I also think they should be reopening those beds that they closed in November, December last year. That's had an additional effect of creating capacity problems in the system, which we're seeing the impacts of day in, day out across the health system at the moment.
So you think the government can put more ambulances on the road if they wanted to? It's just a question of money.
Well, we understand that there's actually reports that they've been sitting on from consultants talking about the fact that ambulance demand is out of control and the response times keep getting worse and worse, and there is a need for more ambulances. They're sitting on this report. They're saying it's cabinet in confidence and they can't discuss it. Well, I think given these serious public health risks, that should be released and we should be able to see what that report recommends. I mean, this is only a few months since we had news of a cluster of deaths from ambulance responses late last year. I hate to think that we might see a similar report in a few months' time about what's going on in the health system at the moment.
That's Chris Picton, Shadow Health Minister. We're talking about a ramping crisis that has occurred in Adelaide today. I was talking to Phil Palmer, who was saying that a scratch crew had to be put together to go to a cardiac arrest. The ambulance officers went there without a stretcher. Unfortunately, the person passed away, but if they had to be taken to a hospital very quickly, that wouldn't have been possible at that time. Chris has called on 1300 222 891. Welcome, Chris.
Well, I'd like to know if Chris Picton has got all the answers, because when Labor were in power, exactly the same thing was happening.
Well, that's a good point, one that's also been coming through on the text line, Chris Picton. It's easy in opposition to criticise, but this is a problem that your government had to deal with day to day as well.
Well, and we continue to invest in the system. We hired significant numbers of more paramedics, more ambulances in the system, and we haven't seen any action by this government to improve that situation. And as I said, we understand they've got a report before them recommending that there needs to be more ambulances. But as Phil Palmer said, Treasury are deciding not to act on that.
Who put together this report, Chris?
I understand that there was a consultant that the government has looked to undertake an analysis of what the demand for ambulances are, what actually needs to be done to have proper response times.
Do you know what does it recommend?
Well, we don't know because it's sitting in cabinet in confidence, but I could only imagine that it recommends that we need more paramedics, we need more ambulances, because the response time statistics are getting worse and worse, and it's real South Australians who are bearing the brunt of that.
Chris Picton, thanks for your time this afternoon.
Thank you.
And Graham has called to say he was at the Aquatic Centre yesterday and an ambulance took an hour to get there for another patron. Yes, lots of text coming through about this. Liz says the Liberal government has grossly underestimated the need of health services in this state. They are demonstrating they're not capable of managing budgets and providing healthcare they should be provided. Someone else says it's Labor's fault. Labor's fault. This is catastrophic, Jules, says someone else. So lots of text coming through about this ramping crisis today, and I'm sure you'll see more on this story on ABC News tonight.